A significant advance in advanced ovarian cancer. A study called the DUO-O trial, designed for newly diagnosed ovarian cancer patients with advanced non-BRCA mutant cancer, showed a significant positive outcome, offering these patients hope for a completely different treatment outcome. The PARP inhibitor, olaparib, Lynparza, and the anti-PD-L1 antibody durvalumab, Imfinzi, immunotherapy, were added to the standard of care of chemotherapy with paclitaxel, carboplatin, and bevacizumab, Avastin. The study's findings indicated a significant rise in progression-free survival, PFS, but not yet in overall survival. The study used patients who had just received an advanced diagnosis of ovarian cancer without a BRCA mutation. According to a pre-planned interim analysis, adding durvalumab and olaparib to the standard of care of chemotherapy, plus bevacizumab alone, was linked with a 37% improvement in progression-free survival. This improvement rose by an additional 51% in patients whose tumours tested positive for homologous recombination deficiency, HRD. This disease occurs in around 70% of ovarian malignancies and implies an inability to properly repair double-strand DNA breaks. These findings are considered extremely statistically significant and clinically meaningful. Speaking at ASCO 2023, where the data were presented, co-principal investigator Carol Agajanian at Memorial Sloan Kettering Cancer Center in New York City was one of many who mentioned the study. According to additional comments, the findings mark a huge step forward for ovarian cancer. For patients with advanced ovarian cancer, the rate of advancement in this research may not be quick enough, but any modest advancement discovered in significant trials like this one is highly significant to certain patients. In around 80% of cases, ovarian cancer is discovered in an advanced stage, and the patients are aware of their difficulties. The majority of them will eventually experience a cancer recurrence. Even though an increase in progression-free survival may not ensure overall survival, it raises expectations for better results. It is vital to highlight this study's excellent findings since patients value progression-free survival greatly. This study advances our understanding and moves us one step closer to achieving better outcomes for advanced ovarian cancer on all fronts. It has also been said that women frequently experience disappointment if their tumour lacks a certain mutation because it may restrict their options for treatment. But this study reveals that all patients can access treatment alternatives, offering them hope. For patients with advanced ovarian cancer, the rate of progress it indicates may not be quick enough, but every small integral improvement we can uncover in relevant studies. Without a doubt, progression-free survival is important for most patients, and this study shows progress in that regard. We are steadily improving the prognosis for advanced ovarian cancer. Although patients may be frustrated if their tumour does not carry a BRCA mutation, which would restrict some of their treatment options, this study demonstrates that options for all comers are available, and there is still hope. Even better, the US Food and Drug Administration has approved all of the medication's uses for those indications. Medical insurance also covers them, and for patients who are financially unstable, there is access to co-pay assistance programs and the like. So, based on their BRCA and HRD testing, the patient can anticipate receiving advice on their projected benefit going forward. This study's findings have been highly anticipated, representing a breakthrough in ovarian cancer. One of the most significant findings was in the HRD-negative patients, and for the first time, there is a positive study in this patient population. The study was funded by AstraZeneca and cooperated with the GOG Foundation, Myriad Genetic Laboratories, and the European Network of Gynecological Oncological Trial Groups. Thank you for your time. We hope you found this video useful. Please like and subscribe to receive more cancer news and updates from Oncolomed Cancer Academy.